Hello and welcome to the K2 BSOTS demonstration. This video will cover the ongoing care period. So we are continuing to pick up our patient Millie Scholes, and we can now see that within the ward overview detail, it has now shown that a priority rating has been set at 2:10, and that the patient is now awaiting ongoing care and has been waiting for 11 minutes between the priority rating being set and the current time as it is now. So what we will now do is pick up again back at the side of the bed using the Guardian system to start going through the ongoing care process. So now we have the bedside view ahead, and again, if the patient's either been moved from one bed to another, the same details will follow through with her. But if we look at the same BSOTS process, again, we can see details of any helpline contact, details of the triage that was set, and now we can progress on to the ongoing care screen. So the ongoing care screens, as are shown here, are tailored around the reason for the admittance and also the priority rating that's set. So in this case, we have Millie, who has been categorised as orange for reduced fetal movement. So again, the screens will show both the priority rating and the initial reason for admittance. And then beneath these are a series of tasks that are kind of prescribed as would be expected to happen for a patient with the relevant priority rating and for the relevant admission reason. And typically, we would be able to work through these screens to record what's happened. The first thing that you would normally do is indicate that we are looking to start the ongoing care, and you would just pop in the details for the midwife who was recording that. We then password or authenticate using the fingerprint. And then again, just as it happened within the triage screen, we can see that the completion status starts to update to show that the ongoing care in this case was started and at the time that it's been started. We can then progress through some of the next steps. So for example, if we look at the complete and categorised CTG option, we can launch it just again from gripping the red pencil so that we can record the details. We can say what time that we'd completed it and who had completed it. But because this event actually has some sort of key data that we would normally be able to capture through the K2 system, there's also some additional sections underneath. So from here, by selecting the Add New, I would get taken directly into the CTG review screen that you would be familiar with from elsewhere within the actions. One moment, sorry about that. So here we could continue through and indicate whether it was an antenatal or an intrapartum CTG review and record any of the relevant details as we saw fit through the screen. Now, for the purposes of the demo, I'm not going to show the full screen collection because we'll be here for a little while. But any records that you do record would be shown up within this table here. And then when we finish and authenticate, password, then we would be able to see again updates, and any CTG reviews in this case that were recorded within there would again be shown and tabulated in this document right here. And if as you're doing a task such as the CTG review and you wanted to actually have eyes on the trace, using this drop down arrow, it pops it down to the bottom so that you would have full details of any CTG trace that was being recorded. Now, some of the other steps again are quite similar. So we've got a perform second CTG review to effectively get a clear set of eyes and looking at the trace and confirming that a second person had viewed it and categorised it accordingly. And then there are some other tasks as well here, such as offering an ultrasound scan, completing an abdominal palpation, or a catch-all, which is additional investigations performed. So this can be useful for any specific detail that may be carried out as part of the review. Here, again, we just complete it in the same way, authenticate as before, and again, we get the details that show up within here. The exact list of the actions that are shown there will change and will vary depending on the priority rating and the initial reason for the attendance. So these won't all be the same, and they will vary from patient to patient depending on the circumstances. But overall, most of these cards do end up with one of a few different options, which really determines what would happen with further care for the patient. Now, based on this one, because predominantly it's an orange rating, typically we would expect it to end with a request for a medical review by a doctor. So to do that, we would just launch the screen, and it's broken into two sections. We first of all got an informing the doctor of the admittance, and then we've got the actual ask and request for them to attend. So in this case, I'm going to say that they are both in case, and I will put in the details of actually who we've asked to attend. If you don't ask them to attend, or don't ask them, or don't actually inform them, then the free text boxes that we see currently greyed out will enable and will be forced to be completed, so that there's documented reason as to why a doctor has neither been informed nor attended within those details. Again, we record the data with our authentication, and that then updates again to show those details. At any point as well, we can then put in some additional free text comments relating to the ongoing care if we want to. So quite similar to how it's structured for any additional investigations that might be performed. So what I'm now going to do is just look back at the ward view through Athena. And we can now see that Millie School is further updated, and the patient management section over here is now saying that an SD3-7 has been asked to attend at the time that they've been asked to attend, and that she's now awaiting a medical review or SAFER review. So we can pick up how the medical review and the SAFER review would be completed in just a moment, but I also just want to show you how you would access the ongoing care details through this ward overview. So within the menu that we have here, we have a section that says enter/view ongoing care, and if I select this through here, we can see exactly the same details are presented. So there is no difference to how this is presented to the user, whether it's used at the bedside using the portal, or whether it's used through Athena on a laptop or a mobile device. They can all be accessed in exactly the same way. And again, we'll update in real time because everything is written to the same source, the same database. So our next step would be to look at completing a medical review. So again, I'll show it through both Athena and at the bedside. Within Athena, you would choose to select the menu here, and this time we would choose to select enter/view medical and SAFER review. And within here, we first of all see right at the top details of who's been asked to attend and what time they were asked to attend. So here we can see we've got the same doctor that I've requested to attend and the time that we said it. And then what we would typically do then is mark that a medic has actually attended, and we will just see it's the doctor. Then if the medic doesn't attend, then details can be recorded within this free text screen. We finish that and record those details, and then we can see that the attendance of the medic is shown there, and it also breaks down the time that it was taken to attend. So again, that can be useful for any sort of auditing purposes. And then to actually complete details of the medical review, you would access the SAFER review screen, which is hopefully some screens that you're familiar with if you've already been using the K2 system. So it's a structured review that enables us to record all details of what's going on. So in this case, we can also see that we've got both a midwife and a doctor present. The reason for review, we would typically in this case select that it's a triage review. And if there were any specific features that we either wanted to review or add extra details to, we can do so. I won't select any for the purposes of the demonstration. We can update any assigned clinicians that are relevant, update the labour status if anything has changed, and then we record any details about the medical assessment or any fetal assessment just within these three text boxes. If for a particular reason it's decided that you wish to expedite delivery, you can record that here. I'll say no at this point. And then it brings us on to being able to update the management plan. So as part of the review process that's happened, the management plan may be details about any further observations or further treatment that's required during this hospital visit. or it could also outline specific reasons as to why the patient may be able to be discharged home. Any of those details can be recorded just by selecting the management plan option here and recording the relevant details and hitting the finish button. They can all be recorded within there. Then we can choose whether or not there's any need to escalate for any further reviews. I'm going to select no, and whether or not there's any further reviews that should be scheduled. So again, in this case, I'm going to select no and record those details. So then, by selecting the hyperlink here, we can see some details of the safer review as was categorised within there. And any other information that's either captured or recorded will be shown in its relevant places within the main patient note for us. So I'll close us out here and then just bring back up the bedside view. So again, that we can see what's changed within here and how you would access it. So again, from the actions menu, you would then choose to select the BSOTS process. And within here, we can see the medical/safer review again. So exactly the same details that I recorded through Athena are then instantly updated, and we also have details of the safer review here. That concludes how a medical review and also how the ongoing care would be handled within the K2 BSOTS system. So the last thing I would like to do is just show you how we would cover off transferring a patient from the bedside back into the ward, but outside of its designated bed or bay, so effectively returning them to the waiting area. So from the bedside, we would select the admission button, and we would select the transfer option here. So the first screen just indicates that, again, just make sure you've reviewed any risk assessments as necessary, and then it gives us some options as to where we want to actually transfer them. So in this case, Millie is already in the triage ward, and we want to remain, we wish her to remain on the triage ward, but we just don't want her to be in this bed allocated to the room that we're currently in. So we leave the ward being transferred to as triage. We can update any type of care to be received, but at the moment, she's still being triaged, she's still undergoing that sort of process. So I'll leave the option as that. And then I am going to put in that she is being transferred for observations and review, for example. Let's finish that screen, and then we get this message to say that the woman will be transferred, will be missing from the current ward list, and that is only true if we are moving her from a current ward. So when we hit OK to that and authenticate, you will see that the bedside view now indicates that we have no patient. So effectively, Millie has left the room as far as the bedside portal is detailing. And if we update our display here, we can see that we now have Millie Scholes has moved from within a bed, and she's now showing up here and unallocated in a bed perspective. And we can also show that she's in the waiting area down here under the designated subcategory that we have here. And similarly, if you wanted to then assign them into a bed using the Athena system, you can just select the option that we've got here, and then we would assign to bed. And say, for example, we now move her into bed 2. Then by doing that, and we can see that she's then moved from that area, and now she can be found under the current in-room based beds option, as shown in bed 2, or again, the overall ward overview has updated to show that she is now in bed 2. So any portal, if Guardian was used in bed 2, it would now indicate that the patient being monitored there was Millie Scholes. So that concludes a little bit about how we can help move the patient from location to location within the triage ward functionality.
Thanks, Chris. Could you please just put the screen back up, Chris, and I'll show the discharge section, please. So obviously, once the woman's been decided that she can go home or been transferred to another ward, you can simply do that from most of the options in the screen by selecting the ward transfer or the discharge remove from ward. This functionality is just the same as you would have on any other ward. So we're not going to explain that here. It's exactly what you would do to just discharge from an antenatal ward or anything like that. So that's just the same functionality. And I think the last thing we wanted to explain was the various different groups that you can see in the ward view there. So we've tried very hard to kind of split the wards, the groups of women up into manageable sections, depending on the types of status they have. So obviously you have the ward overview, which shows all of the women in the ward. But obviously that could be quite a number, especially on large units. So we've broken down the various stages they would go through from expected to attend. You can see that as the list below. That shows all the women that are obviously going to come in. Then the next one is those currently in beds. And then we have the three kind of waiting stages where they're waiting for triage, waiting for ongoing care, and awaiting medical review. And each of those lists is summarized by the tags that are in line with the title of those groups, and obviously they will color and show the number of women waiting in those various stages, whether they're green, yellow, orange, or red. And obviously then some of them will show overdue, because we understand of the 50 minutes waiting time to be triaged, and then the various waiting times for ongoing care and medical review in that. So if a woman is overdue their time limit, then that will show in those tags as well. So that's hopefully providing you functionality to help you manage the flow of women through the triage unit according to the BSOTS principles. So that concludes our informal demonstration of the K2 Athena BSOTS functionality. Thank you very much. Bye.